we have to start with a gait. So now the patient is asked to do walking. Yes. Now you check the gait and then come back please. Okay, there are 4 obvious types of the gait. 1, translumbar, 2, antalgic gait, 3, high stepping gait, and then 4, there is a hemiplegic gait. So you have to check the gait. Okay, after that, the patient is in standing position. You have to check the spine, in general, skull, sinus, skull, sinus, and then after that, wasting, deformity, and so many things. Okay, out of them, deformity is the most important. So you have to check the scoliosis, you have to check the kyphosis, and then you have to check the lordosis deformity. So, okay, if there is a kyphosis, if there is a scoliosis, you have to check with the Adam test. You have to proceed the Adam test. Adam test is bending forward. So, now the scoliosis disappeared in Adam test. It means the scoliosis is the postural scoliosis. If the scoliosis is marked on the Adam test, yes, it is the structural scoliosis. And then, if there is a kyphosis deformity, you have to do the wall test. Okay, wall test means the heel, buttock, shoulder, and occiput should touch to the wall. If in kyphosis, especially in the ankylosing spondylitis, the occiput cannot touch to the wall. This is the wall test. Yes, if there is a translunar gait is positive, okay, you have to do the translunar test. So, for example, the left hip is disease site. So, ask the patient, there are 2 types, from front and from back. Now, I am showing the front test. Okay, put the patient's hands on your hands and then ask the patient to stand on the normal side first. Now, he can balance. So, there is no weight here. Okay, then ask the patient to stand on the disease side. So, actually, with the disease side, with the disease side, the pelvis is going down actually, but the body twisted. The patient wants to kick, so the patient sway the body to lift the pelvis. The body lifted to the disease side. So now there is a pressure on my hand. So the pressure is on the disease side. It is the triangular test. Okay, we finished the inspection. In inspection, in repeat, scar, you have to see the scar, sinus, swelling, deformity, wasting, and so on. Okay, then feel. Feel firstly on starting from the cervical spine in midline. So there is a spinal process. Then in between the spinal process there is an interspinal ligament. You have to check any tenderness. Then you have to check up to the sacrum. Then you have to check the paravertebral muscles. Is there any tenderness? This is for the tenderness. And then you have to check the temperature, both sides. Temperature, both sides. This is the palpation. Okay, then look, feel. After that, movement. So the patient in standing position, he can move, flexion, active. Then extension, lateral bending should be done. But you cannot do the rotation in standing position because of the pelvic rotation is there. Okay, after that, you have to do the look, feel, move, measure. You have to measure. There are 2 things. Measurement in chest, measurement chest circumference, and then spine excursion. So chest circumference. So in chest circumference, here at the nipple line. So at the nipple line, for both the measurement, you have to mark the lower border and upper border. So above there, take upper border here, lower border here, upper border here, lower border here. You have to mark. Because anybody can come and measure it. They must measure in this area only. So marking is important. Then after that, you have to ask the patient to expirate, to breathe out first. Breathe out and measure. After that, ask the patient breathe in fully. After that, yes, hold on and measure it. Okay, then so there's a difference. The difference is in normal 5 to 7 centimeters. Okay, after that, spine excursion. Spine excursion, firstly, so you have to find out the dimple first. The dimple, here is the dimple, here is the dimple. This is the marked area of the posterior superior iliac spine. Then you have to draw the line between the 2 points, and here you have to draw the line. Okay, after that, so 5 centimeters below, 5 centimeters below the line, you must mark here. 5 centimeters below the line, you must mark. Then 10 centimeters above the line, you must mark here. So in erect position, the 2-point distance is 15 centimeters. Okay, then ask the patient to bend forward. Bend forward, and then you measure again here up to here. So now the distance between the 2 points is about more than 20 centimeters. It means spine excursion is more than 5 centimeters. It is normal. In ankylosing spondylitis, the less spine excursion is less than 5 centimeters. Then after that, in sitting position, you have to check again the spine. So sometimes scoliosis disappear in sitting position. In this case, the scoliosis is the posterior. As for example, if there is a hip problem, or maybe the side, maybe the PID. And then after that, after look, and then you have to fill. So fill, yes, here, fill for iliopsoas. Then iliopsoas. You have to check the iliopsoas. Okay, raise your thigh, please. Then you press against the, now flexion of the hip against the resistance. It is the test for the iliopsoas muscles. Okay, feel. Then after that, move. Move is that he is in the sitting position. Then test for the rotation. Okay, twist. Okay, twist. So this is the rotation. So these are the look, feel, move in sitting position. Okay. Now in lying position. Firstly, prone position. In prone position, you have to check again the spine. Look, as I already told you, the skull, sinus, swelling, and so on. So you have to repeat the sides. After that, feel. So you can repeat the tenderness over the spine. Then after that, you have to do the special test in prone position. Firstly, you have to do the femoral stretch test. Femoral stretch test, here, just flex the hip, flex the knee, and then raise up. This is a femoral stretch test because femoral nerve is in front of the thigh. Okay, if you do it the patient will experience the pain. This is called the femoral stress test positive. If the femoral stress test is positive, the femoral nerve formation, you will remember L2, L3, L4. One of the nerve root is compressed by something. So L2, L3, L4, one of the nerve root is affected. This is the femoral nerve stress test. You have to do both sides. Okay. Then after that, motor power. Motor power, you can test the hamstring muscles. Hamstring muscles action, flexion of the knee. Do it against the flexion of the knee, against the resistance. This is the motor power. Then sensory, back of the thigh, back of the leg. You have to test with the probe. So for painful stimuli, this represents the S2 dermatome. Then you can examine the popliteal artery position. Flex the knee, relax the popliteal fossa, then press. Then after that, at the back of the femur, at the back of the supracondylar region, you have to feel the popliteal part, and then you can feel the posterior tibia position. Yes, these are the signs test in the prone position. Another lying position in supine position. In supine position, you can check thyroid, breast, chest, abdomen, and testes. So, because if there is some tumors, so the back pain may be due to the secondary or metastatic bowel disease. So you have to check these things. After that, you have to go to the straight leg raising test. For example, right side is disease side. Left side. So, for example, left side is the disease side. So you have to start with the normal side. Here, this is the straight leg raising test. So right side is normal, around about 80-90 degree. After that, you have to do the left side. Left side, when about here, the patient experiences the pain. So this is the SLR is 30 degree. Okay, here you have to ask the patient, where is the pain? If the pain is only in the back, it is the problem is in the lumbar spine, for example, lumbar spondylosis, or maybe the rheumatoid arthritis, maybe the ankylosing spondylitis. Okay, if the pain is going down along the leg, so it is called the sciatica. It is due to the compression on the sciatic nerve root. What are the sciatic nerve root? Sciatic nerve root are L4, L5, S1, S2, S3. Commonly, L4, L5, S1 nerve root are compressed in prolapse intervertebral disc. Okay, now this is the straight leg raising test. Okay, sometimes, if you raise the normal side, but the patient has the shooting pain along the other opposite side, it is called cross leg pain. It is the dangerous sign of the central disc herniation. Central disc herniation can result in cauda equina syndrome. So you must be careful. Okay, if there is a straight leg raising test is positive, you have to proceed in special test. The special test here, this is normal. Here, this is the SLR is 30 degree. Now, you have to do the special test. So, here, there is a pain. Then, at that stage, you lower down the leg a bit. So, the pain relieved. At this stage, you actively dorsiflex the ankle. The patient suffers pain again. This is called breaker test. Okay, I will repeat. Here, pain, lower down, pain relief, and you do the dorsiflexion again. So there's a pain again. So this is called the breaker test. Okay, another thing is the bowstring test. Okay, here straight leg raising test, positive 30 degree, painful. Then the knee is flexed. So a bit flexed, not too much, a bit flexed. So the pain relief. After the pain relief, you press with your fingers, you press the common parallel nerve against the femoral condyle. So there's a shooting pain along the sciatic nerve. This is called bowstring test. Bowstring. This is bow. The string is the sciatic nerve. Bowstring test. Now we are going to do the neurological examinations. In neurological examination, motor power. I will check the motor power by flexion of the hip. Okay. Up please. Yes. This is the hip flexion. I am checking the hip flexion. So hip flexors. Hip flexors are supplied by the L2, 3 nerve root. After that, so you have to do the both sides. Then after that, extension, knee extension against the resistance. Okay. Yeah. This is the knee extension. The knee extensor is supplied by the L3, 4. Then knee flexion. So flex. So now flexion against the resistance. Now the knee flexors are supplied by the L5, S1. Okay, you have to do the both sides. Then after that, ankle dorsiflexion. Now against the resistance, ankle dorsiflexors are supplied by the L4, 5. Then plantar flexor. Plantar flexors are supplied by the S1, 2. After that, you have to check the big toe. Big toe extension, go. So big toe extension against the resistance. Big toe extension is supplied by L5. Okay, down. Plantar flexion of the big toe. Plantar flexion of the big toe is supplied by S1. In this way, you have to check the neurological deficit in motor power. Okay, after that, you have to do the sensory. Sensory, upper part of the thigh, L1. Middle thigh, L2. Lower thigh, L3. Then, medial aspect of the leg, this is the L4. And then, lateral aspect of the leg and dorsum of the foot. So supplied by the L5. But you have to test at the first dorsal west page. So this is the dermatome of the L5. Okay, after that you have to check the sole of the foot. Then this is the S1. So after that you already test in prone position, back of the leg and thigh. This is supplied by the S2. Then in buttock, it is from here. In buttock, it is supplied by the S3. Then perianal region, it is supplied by the S4. In this way, you have to check the sensory deficit. Okay, the next step is the reflexes. Here, you have to do the knee reflex with a hammer. But sorry, we don't have the hammer at the moment. So you just do the knee reflex. Knee reflex represents the L4. After that, here you relax it, and then here, after that you have to do the ankle reflex. Here, flexion of the knee, then you tend to outreach, then next you put it. Then there is an ankle reflex. it represents the S1. Okay, these are the knee reflex and ankle reflex. Okay, after that, sometimes in low back pain is due to the posterior sacroiliac joint. So to exclude the sacroiliac joint, here, so favor test here across the leg is over the opposite thigh. Then after that, you control the ankle, then press the knee. This is the favor test. So this is testing the left sacroiliac joint. So in this way, you have to exclude the sacroiliac joint. Okay, another test is the palm huddle test. So you flex the hip and push to the opposite shoulder. Push to the opposite shoulder. So this is the palm huddle test. This is also meant for the left sacroiliac joint also. Okay, final examination, you have to check the upper limb also. Upper limb, motor, sensory and reflex also. So upper limb, abduction of the shoulder. Yes, abduct against the resistance. It represents the C5 nerve root. Okay, then abduct close to the body. Then abduct, this is the, it represents the C6, 7. After that, elbow flexion, C against the resistance, C5, 6. Okay, elbow extension. Okay, against the resistance, C7, 8. Okay, you have to do the both sides. After that, wrist flexion, extension, flexion. They represent the, both represent the C6, 7. Then after that, fingers. Here, close. Yes, grip my hand. Okay. Then this is the flexion of the, okay.
Yes.
This is the flexion of the fingers. So it represents the C8. Okay. Then extension of the fingers. Extension down. It represents the C7. Okay. Abduction of the fingers. It represents the T1. Abduction can be do like this again. Here, spread the fingers and push to each other. So to test the weakness. Okay, these are for the motor power. Sensory, you already know in second year. So the shoulder, above the shoulder, this is the C4. Then lateral side of the arm, C5. Lateral side of the forearm, C6 up to the index. Then middle finger, C7. Then ring and little finger up to the middle aspect of the forearm, C8. Then middle aspect of the arm, T1. In this way, you can check the dermatome. After that, reflexes. Reflexes, you put here, you do the bicep, you put the fingers on the bicep tendon, then reflex with the hammer. Bicep reflex. It represents the C5. Okay, tricep, here like this, and then you use the hammer, you can test the tricep reflex. It represents the C7. Okay, after that, here, supinator. Supinator, you use the hammer here, supine over the supinator, and then will like this. So this is the supinator. It represents the C6. So bicep C5, tricep C7, supinator C6. That's all. your nipple line and umbilical level in your examination. So, nipple line, you have to test the sensation of the nipple line. It represents the T4. Then, after that, you have to test the umbilicus, both sides. It's the umbilical region. It represents the T10. So, at the last action, as a last action, you have to do the PR in the lumbar spine examination if you have a chance. Okay, these are the lumbar spine examinations.